All right, welcome everybody to the January 19th, 2021, 2 p.m. consent agenda. Please let the record reflect that all three commissioners are present. Today on our printed agenda, we do have one public hearing item, which is public hearing item number 5, and we do have a by-leave item as well, which is by-leave item number 6, which is a resolution in the matter of appointments to the Spokane County Citizens Commission on Salaries. If we could take items 4 and 5 separately, 5 being the public hearing item. Other than that, the chair is open to a motion if neither of my seatmates wish to take anything else separately.
I'm good.
Okay, is there a motion?
Okay, Mr. Chair, I move that we approve items number 1, 2, 3, and 5, by-leave item 6 on today's agenda.
I'll second that motion.
We have a motion to approve items 1, 2, 3, and by-leave items number 6, including all sub-items thereunder. Any discussion? Okay, seeing none, all in favor, say aye.
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 Aye, motion passes unanimously. All right, that brings us to item number 4, and I believe Mr. Amacio was going to make a short presentation.
Thank you. Thank you very much, Chairman Kearns. Can everyone hear me?
Yes.
Thank you. Chairman Kearns, item number 4 is entitled Matter of Reconsidering and Rescinding Spokane County Resolution number 20-1030, item number 1 only. I've asked Mr. Valencia to put up on the screen 10 very short facts which I'd like the board to be aware of. Number 1, as the board will recall, December 15th, 2020, the board held a public hearing to consider amending the Tourist Promotion Area Ordinance. Item number 1, in conjunction with the amendment to the ordinance, dealt with the addition of a, quote, additional charge to be added to room fees. Item number 2, in conjunction with the public hearing, dealt with the inclusion of a termination provision in the ordinance itself. As the board is aware, item number 1, dealing with the, quote, additional charge, end quotes, required the submission of a petition to be signed by 60% of the lodging businesses who would pay the, quote, additional charge in order for the Board of County Commissioners to consider imposing that additional charge. Item number 2, which we considered, was the addition of a new termination provision to the ordinance. This item did not require the submission of a petition. At the outset of the public hearing, I advised the board with regard to the additional charge that we had a petition submitted by 62% of the lodging businesses who would pay the additional charge. And again, the board had to have the signatures of 60% of the lodging businesses. Based upon that information, and after considering all public testimony, the Board of County Commissioners on December 15th, 2020, approved resolution number 1020-1030. Resolution number 20-1030 approved the additional charges set forth in the petition and the notice, as well as the additional termination language to be placed in the ordinance. Sometime after we formally took action on resolution number 2020-1030, the Board of County Commissioners was advised by the Tourist Promotion Area Manager that as a result of some additional due diligence, which we had not done previously, the petition necessary to enact the additional charge only contained the signatures of 57.2% of those lodging businesses who would pay the additional charge. As a result of this new information, the Attorney's Office is advising the Board of County Commissioners that we must reconsider our action under resolution number 20-1030 to rescind the approval of that resolution of item number 1, which would be the inclusion of the new additional charges. This particular item, Chairman Kearns, requires 2 motions by the Board of County Commissioners. Firstly, there must be a motion to reconsider the board's action on December 15th, 2020, approving resolution 2020-1030. If that motion receives a majority vote, then we will go to a second motion. And the second motion is going to be rescind the Board of County Commissioners' approval of the additional charges under item number 1 under resolution number 20-1030. Item number 2 would still remain in full force and effect. This is not a public hearing item, Chairman Kearns. Instead, it is simply an item for action by the Board of County Commissioners. Unless the board has any additional questions, which I'm glad to answer, I think we're ready to consider moving forward with the 2 motions.
All right, is there a motion to reconsider?
Yes, Mr. Chair, I hereby move to reconsider the board's approval of item number 1 in resolution number 20-1030 based on the advice of the prosecuting attorney's office.
Second.
Motion and a second. Any discussion? Seeing none, all in favor say aye.
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 Aye. Motion passes unanimously. Is there another motion?
Yes, Mr. Chair, I move to rescind the board's approval of item number 1 in resolution number 20-1030 based on new information that the petition necessary to consider item number 1 did not contain 60% of the lodging businesses that would pay the additional charge. Item 2 would remain adopted.
Second.
Motion and a second. Any discussion? Seeing none, all in favor say aye.
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 Aye. Motion passes unanimously. That brings us to item number 5 on our agenda, which is a public hearing item. And we will lead off with another short presentation by Jim Amacio.
Chairman Kearns, you said the word short twice, so I'll try to keep it as short as I possibly can. Although I am aware of the fact that there are individuals who will be testifying with regard to this particular item. Chairman Kearns, item number 5 is entitled, "In the matter of a resolution to amend section 3 of Spokane County Resolution number 04-0211 as amended regarding the ordinance establishing a tourist promotion area having boundaries including the city of Spokane Valley, and unincorporated area, Spokane County." Board members, as you are aware, in the previous item, the Board of County Commissioners rescinded its approval of item number 1 under resolution 2020-1030. As a result of that, the hotel motel industry and the tourist promotion area commissioners requested the Board of County Commissioners to again consider a hearing to increase the special charges incurred by hotel and motel businesses in the TPA area. The increase in fees known as additional charge is exactly the same as those were the subject of the hearing on December 15th, 2020. We have received a petition on Friday, previous Friday, and that petition was submitted Marie Dodro, and it indicated that the new petition submitted by the lodging businesses in support of the quote additional charge in 5 of the lodging zones is supported by 68.8% of the lodging businesses who would pay the additional charge. This particular petition has been gone over very closely by Marie Dodro, and I will advise the board that the reason we believe this petition is an accurate petition is because since the last petition that was submitted, Marie Dodro has gone to the Department of Health and got their listing of hotel lodging businesses. She has gone to the Department of Revenue. We have their list of lodging businesses that pay the excise tax. We've gone to the Hotel Motel Association and got their list of members. And we also have the list by the Star Association. We've compared all those lists, and we believe that we have an accurate list of all the hotel, motel, or lodging businesses within the boundaries of the TPA, and therefore we believe that the 68.8% of the lodging businesses do in fact support the additional charge as we've advertised. I would remind the board that this particular additional charge, if approved by the Board of County Commissioners, will become effective April 1st, 2021, and it will automatically expire by law on July 1st, 2027. Unless the Board of County Commissioners has some questions about any other elements of this public hearing, I would turn the matter back over to Chairman Kearns, and this is a public hearing item.
Okay. Commissioner French, Commissioner CUNY, any questions for Mr. Amacia?
I'm good.
Okay. All right. So as stated, this is a public hearing item. I think we are going to lead off with Dean Feldmeyer. He was the first one to use the chat function. If there is anyone else on Zoom that would like to testify, please use the chat function at the bottom of the screen and notify us of your desire to testify. But we will start with Dean Feldmeyer. You have 3 minutes, Dean.
Thank you, Commissioner Kearns, and thank you to both of the other commissioners and to Mr. Amacio for your patience and flexibility with this. We certainly learned that there were multiple lists that were in play and made the mistake of stopping a little bit short after we got over the 60%. But the hotel community still remains very much in support of expanding this tourism assessment with things on the horizon like the podium being opened later this year, and certainly the downturn in collections from due to occupancy from other sources like lodging tax and also the TPA. We think now is the perfect time to do this. So the lodging community, and speaking for one of the downtown hotels, remains largely in support of this. That's all I had to report.
Okay. Thank you, Dean. All right. Next up, we have Matt Jensen.
Oh, hi. Thank you again for your time, everyone. I'm Matt Jensen. I'm with Davenport Hotels, and I represent a company that has about 1,700 hotel rooms in the downtown core. Most of our hotels are large hotels that rely heavily on convention and group, primarily the Davenport Grand, which is connected to the convention center, as well as our historic Davenport 106-year-old landmark hotel in downtown, the Davenport Tower, and the Centennial Hotel, which is just across the river in the convention center, also is a large group hotel. We also have a small hotel, the Hotel Luso, the Davenport Luso, which is 48 rooms, and all 5 of those hotels rely heavily on convention and group business. And it is critical that we continue to fund Visit Spokane. It's a very competitive group market out there with other cities clamoring for conventions and groups. And this TPA funding helps us market Spokane and be as competitive as we can be. along with the sporting market, with the podium coming online, that's going to be a critical piece to our businesses as well, especially the Centennial and the Davenport Grand. So we really are in favor of this new TPA and hope that it helps keep our Visit Spokane and Sports Commission healthy into the future. So thank you for your time today.
Thank you, Matt. All right. Also want to ask if there's anybody on the phone that would like to testify. Please speak up now. All right. Anybody else in the chat? Okay. Again, if anybody would like to testify on Zoom, please use the chat function. Okay, we're going to do first call, second call of anybody wishing to testify, third and final call of anybody wishing to testify either on the phone. If you're on the phone, please just speak up. If you're on Zoom, please use the chat function. Seeing nobody else speak up, we will close the public hearing on item number 5. I will look to my fellow commissioners for a motion.
Chairman Kearns, this is Mr. Amacio speaking. I apologize. I forgot to advise the board that in fact you did receive one letter in opposition to the additional charges, and the clerk of the board provided you with that document. It's an email which the board received last Wednesday, the 13th of January, from Mr. M. Taylor. And Mr. Taylor is the manager of Madison Inn, which is a 79-room hotel near the Sacred Heart on the South Hill. And it's south of the Sacred Heart, as I'm sure we're all aware. He's objecting to it, and he writes as follows. Our hotel accommodates mostly medical guests, and this increase would be a major hardship for them as well. I strongly urge you to reject any increase in rate at this time. Passing this proposed increase represents a serious lack of judgment and adds serious hardship to the already struggling hospitality business and customers in Spokane County. So I apologize, Chairman Kearns. I meant to draw that to your attention during my presentation.
Okay, thank you for bringing that to our attention, Jim. Commissioner CUNY?
And Mr. Amacio, then if you're going to speak to that, excuse me, that letter, we also received 2 other letters in favor.
Excuse me, Commissioner Kearney, you are correct. The other 2 letters we received, one was from Tony Hansen, and Tony Hansen is the executive director of the Spokane Hotel Motel Association. And she sent a letter urging the Board of County Commissioners to hold a new public hearing on the imposition of the additional charges. And in part, based upon that correspondence, that we set this particular public hearing, and a new petition was circulated and contains the signatures of 68.8% of those supporting the additional charge. Additional piece of correspondence, Commissioner CUNY, is from David Taylor, and is from, Maureen Dodro. And Maureen Dodro has submitted this correspondence in behalf of the Spokane Hotel and Motel Commission, also known as the Tourist Promotion Area Commission. And again, this particular correspondence encourages the board to proceed with another public hearing to consider the imposition of the additional charge based upon a new petition that was ultimately submitted. Those are the 3 pieces of correspondence, and thank you very much for Commissioner CUNY for reminding me of the other 2.
Thank you very much. So with that, Mr. Chair, I move to amend section number 3 of the Spokane County Resolution number 04-0211 as amended regarding the ordinance establishing a tourism promotion area having boundaries including the City of Spokane Valley, and unincorporated area of Spokane County to add the additional charges which were the subject of this public hearing.
Second.
All right, we have a motion and a second. Any further discussion? Seeing none, all in favor say aye.
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 Aye. The motion passes unanimously. All right, that does it for all of the items on our printed agenda. So that now brings us to a presentation from the Spokane Regional Health District. And let's see, as we get Zoom taken care of here, if we have everybody on the line with us.
Lindia's on.
Okay, we have Lindia joining us from Spokane Regional Health District. Lindia, will there be anybody else joining?
Just me.
Just you, okay.
Yeah.
All
So,
right.
good afternoon.
I did want to just make an announcement. We had sent this this link out to a number of our county staff members, county team members. So if there is anybody that is watching that does have a question, please use the Q&A function at the bottom of the screen and type in your questions. Then we'll get those asked to Lindia as time allows.
Great. Thanks for having me. I know that some of you have seen the presentation. And as of a week,
Oh, and if there's anybody on, please mute your phone so we don't receive any feedback.
so as of a week ago, it has changed somewhat. And so this is what I know current as of January 19th. So I'm going to cover the roles and responsibilities of vaccine planning, phases and tiers, the vaccine venues, a little bit about the enrolled providers, delivery and inventory, and then where our sources of information can be obtained. Next slide.
If we have anybody joining us on the phone, if you could please mute. It sounds like that's where our feedback is coming. It's from someone that's calling in by phone. If you could please mute your phone, we'd appreciate it.
Next slide. So there's some confusion around the roles and responsibilities of vaccine planning. And I just wanted to clarify that the state really is the lead on the vaccination program. They are the one that develops all of the guidance on the priorities and phases and the allocation. They recruit and enroll providers in our community and manage how the allocations of vaccine goes out. They distribute the vaccine directly to providers, and I will share a little bit more about that concept, and also are responsible for all of the education materials and media that's going out. So our Spokane Regional Health District role, or local public health, is really to augment what the state is doing. We encourage providers to enroll, and we also do oversee how they store their vaccine and if they're properly using it. We participate in a lot of partner planning to engage them, and really our role is to fill the safety net. We're not a healthcare provider, but we can actually get vaccine to those that have limited access. And then we also are looking for opportunities all the time to increase the access in the community. So we work a lot with our partners to set up drive-through clinics or vaccination, mass vaccination events. Next slide. So there's a lot of things to consider when we're planning vaccine. We look at the supply that's available. As we know, it hasn't been flowing as readily as we hoped from the federal government. But we have to really make some assumptions of that it's going to keep coming and that the supply is going to pick up. We also have to worry about the number of providers in our community that have actually enrolled to administer the vaccine. And then we're using this phased approach on highest to lowest risk groups. And in that phased approach, we have to kind of determine or estimate how many people will actually get the vaccine and if they will have different limitations to the access. We know that different populations are hesitant and that some cultures are more comfortable in some settings over other settings. So all of these areas or variables, we have to take into consideration on how we do our planning. Next. So this is already out of date since I showed it last week. The state government has decided to move the 70-year-old population down to 65 and has defined the multi-generational households. So we currently in Spokane are in phase 1, tier A, 1 and 2. We are still really focused on our high-risk healthcare workers and our first responders, our long-term care facilities, and other workers that are in a high-risk setting. We'll be moving to B as soon as possible, but we really have to have the vaccine before we can move to the next phase. And we keep getting asked kind of when will that be, but we're expecting vaccine to increase over the next couple of weeks. So through this chart here, you can see we'll stay in phase 1, tiers A and B, probably through March or April. And then we'll move on to phase 2, 3, and 4 after those phases are taken care of. So one of the things to look at this chart is that we get the question around where does an essential worker fit? And for government, essential workers are kind of scattered throughout these phases. They're in each of the groups. And so when we look at whether a government worker or essential worker is qualified for a phase, we have to ask for a lot of different questions to determine if they're at high risk of getting exposed or they're high risk in giving it to others. And those are some of the questions that are asked of whether the essential worker would be vaccinated in early phases or later on in phases. For example, I'm a government worker, but I'm very low risk in being exposed and to exposing others that would have a high illness. So I probably wouldn't qualify until maybe even like phase 2. Next slide. So these are the recommendations of a statewide vaccination collaborative that's really looking at equity issues and some of the criteria that they're using to determine where people fit within the phases. So one, do people have access barriers to getting their health care? Are they at higher risk for exposure just because of their occupation or where they live? Are they providing care for others who are at high risk? People who live in areas with a lot of other people, congregate sites are a higher risk, and they also may have lower access to vaccines or health care. People at risk for severe illness and people at risk of spreading it. So I'm just pointing these points out because that is how really those phases were determined and how it was decided that high-risk people would get vaccinated first, and those of us that are less exposed or can expose others would get it later on. Next slide. So I just wanted to share some venues of where the vaccine will be provided. We will use our traditional ways, such as through our healthcare providers and pharmacies. And the providers themselves can decide whether they're going to be a closed pod or a point of dispensing, or they can be an open pod. And basically that just means that if you're closed, you have to be a member of that provider. And if it's an open point, you can be outside of that membership. Some of the sites will be stationary, and then we also know that some of the providers will be using mobile units that can go out to different areas in the county. Pharmacies are basically an open pod where you can go to any Walgreens or any Safeways, and you don't have to be a member. As of right now, 111, we know that there are 51 approved providers in our county, and a little over 110 have applied and are just waiting for approval. Then for public health, we also enhance the traditional venues with our own models. And we call them vaccine liaisons, where we give them the vaccine and they work under our health officer as standing orders. So we have given vaccine to the county Jill and Geiger, and they use their own staff to vaccinate their staff. We are working with some of the school districts and training the school nurses to provide the vaccine to their teachers and other personnel when they get to that phase. We use a lot of our universities in the area where we have the College of Pharmacy or Nursing, the medical school, and their clinical students can come and use our vaccine and operate under our health officer license. The emergency medical services efforts that were going on at the Fire Training Center was basically a vaccine liaison model where they used our vaccine, and then the EMTs were able to vaccinate different first responders. So it could be where they use a model of they come and get our supplies and vaccine, and we call it the pack and go model. And then they go out to different places like our shelters, our long-term care facilities, and vaccinate people. Sometimes we use school districts, parking lot, or we use the fairgrounds or different areas that we can use more of a curbside where you are in your car or it's outside. A lot of times we use our Medical Reserve Corps as the volunteers for those curbside models. We also contract with mobile units and put together drive-through clinics, which is what the EMS did at the Fire Training Center. Chaz is right now at the arena, and they will be possibly doing either a drive-through or moving it inside the arena. And then as of yesterday, the governor did announce that Spokane will be hosting a mass vaccination event using National Guards and some state resources, and it would be run out of our arena potentially, or we may be finding them an alternative site since Chaz is already at the arena. Next slide. So the vaccine flows from the federal administration, and it could go directly from the CDC or the manufacturer to the Department of Health, or it could go directly to a large provider system, such as Albertsons or the Providence healthcare system. And then DOH will then also send it to vaccine enrolled providers, which I had mentioned there are about 51 of them. And so that's how we get the vaccine here in the county. A lot of people think that we are the ones that's allocating the vaccine out, and it just comes to us just like it does anybody else, any other pharmacy. We are also a vaccine enrolled provider. So you can see on the chart the number of doses that Washington has received, and most of it has been distributed out through the state. Only about 42 to 50% have actually been in somebody's arm, so actually administered. And that number is going up all the time as we get more and more of these clinics set up and established and running. I don't have any updated numbers for how much vaccine is in Spokane County. The state is working on that and that data and hasn't updated the numbers most recently. Our health department has received about 5,000 doses, and we've administered about 90% of our original allotment. And then just today we received 1,200 more doses. Next slide. So this is just the last slide about where people can go for information. There is a state playbook that's basically a plan, and it's based on the Centers for Disease Control information. And we also have a plan that we based it on the state. There's a newsletter that anyone is welcome to sign up for. It's a weekly newsletter. It has a lot of good information in it. And then if you go to the DOH website, there is a lot of materials, apps, They have a dashboard, and their dashboard as of tonight should be live and include all of the vaccine information that's been distributed and administered in the state. So you can actually see how many people have started their doses, completed them, and the percentage of the population that has had the vaccine. They are doing statewide media campaign that you probably have seen on the TV, and we help support that campaign. So for locally here, if you want as local information that you can get, you can go to our website, and we try to keep it current. We worked really hard on it last week to make sure that when somebody goes, they can see how to find out when they'll get the vaccine and where to go. And I know Commissioner Kearns, that was one of the things that you really wanted to see. So we worked hard on that. We also use a statewide call center that people can call and talk to somebody about where they would be in the phases. So I think that's it, unless there are some questions.
Yeah, again, if there's anybody that's on Zoom that would like to ask a question, please use the Q&A function. And we do have one question that's queued up. I'll just read it word for word here for Lindia. It says, just to clarify, Spokane County is in phase 1A, or I'm sorry, A1 and A2, correct? It says we are not yet in B1.
That's exactly right. So in a clinic, if they do have vaccine left over at the end of the day, they don't want to waste it. So they will grab people in the 1B area, but not until we get through the first phase A or tier A. All those numbers are confusing.
Okay, and then we have another question here. Again, I'll just read it word for word here. What is to stop someone that is not yet entitled to vaccination to go to, for example, Safeway Pharmacy and get the vaccine?
So we were using a voucher system, and it's a little bit cumbersome. So we will be moving to using Phase Finder, which the state has rolled out. And then individuals will have to show where they landed on Phase Finder and if they're eligible for the vaccine. If it's age driven, then you would have to show a form of ID showing your birth date.
Okay. Okay. And then have another one that came in through the chat function. It says, do Spokane County employees that reside in Idaho receive the vaccinations from Washington or Idaho?
Complicated question. It kind of depends on your occupation. So if you are at risk because of your job, then I would say use Washington. If there's a reason why you need to be safe because of your personal life in Idaho, you may want to go to Idaho. I'm exact same situation. I live in Idaho, and I kind of have to look at where it makes sense for me to get my vaccine.
Okay. All right. So if there's anybody else who would like to ask a question, again, please use the Q&A function. So if we'll just give that a few more seconds here. Is there anybody else on Zoom that has any questions? Commissioner French, Commissioner Cuny?
I see you just got one more question there, Josh,
Okay.
that came in, but I just want to say thank you, Lydia, for coming in and giving us this presentation, because it's been very confusing for a lot of our citizens to understand kind of how this is all working. There's a lot of people that think our local health district has a lot to do with it, where we're kind of, just helping the State Department of Health, but it's all, flowing through from the feds down to the State Department of Health. So I just want to say, thank you for, I know you're going to be doing this to other organizations and just kind of, getting the word out there as to how this is happening and how the rollout is going on. So thank you.
Great, you're welcome.
So I did go on the website and signed up this morning, and it gives you a screen that says, thank you. Mr. French, you are eligible to get COVID-19 vaccine now. And but you have to take a screenshot. And so I did the screenshot. And so now the process is I just find a distribution location, whether it's, either the Coliseum or Walgreens or Safeway or Albertsons, walk in and show them that I know the secret handshake, and they should shoot me up. Is that pretty much it?
Yes, so I'm not sure what phase it said that you were eligible for. Making sure that the place that you go is giving them beyond the 1A group. So like I mentioned, Spokane hasn't moved much beyond that because we're still vaccinating our first responders and healthcare workers. And so some of the places haven't moved into the next group yet. So just make sure you ask before you go if they're accepting your phase that you're in.
Okay, thank you.
And Lindia, we have another question here that says, are public defenders considered front line for priority?
I believe they fit within the law enforcement group as essential workers and higher risk. And so I believe that's when they would be called into it.
Okay, and then have another one here that says, does support staff in the sheriff's office classify in 1A? Or I'm sorry, A1. Sorry, I keep mixing those.
Yeah. So again, it kind of it's based on their risk. And when you go through Phase Finder, it'll ask the person whether they have the capability to be away from others, to, social distance or work from home. And if they answer yes to some of that, then it will bump them down and they shouldn't get it right away. So it's based on risk and really trying to get to those that are most at risk first, and then save it for those that are less at risk later. Okay. If any of those staff are 65 and older, of course, then they are eligible earlier on.
Okay. All right. And then we have another question here. After receiving your first vaccine, what's the process for getting your second vaccine?
So what I understand is most of the healthcare providers or venues are giving a card out saying when your second dose is due, and they'll either say, come back to the same place, or they will say that you'll be notified on where to go. Okay. So for example, some of our 1A staff got it at the fire training center, and the fire training center will be having the second dose clinic in February. So we'll send them back to that site.
Okay. So to clarify, Commissioner French, when you just took the survey, so that was the Phase Finder survey that you took?
Yes.
How long did that take to complete?
Well, maybe a couple minutes. It was actually pretty simple, pretty straightforward, even for somebody of my my youth. So it went pretty smoothly and stuff. So yeah.
Okay.
So a question for you. So if you're going to travel, and let's say you've got both vaccines, both doses, do you get a card or something to show that you've been fully vaccinated and that it's safe to go on a plane, or do you still have to provide some kind of a 72-hour test that shows that you don't have COVID?
Good question. From what I understand, you do have to show some type of paper that you've been vaccinated, and some are requiring that you still have a negative test 3 days prior. So I haven't heard a change in that, but that was the latest that I heard.
Okay.
Okay. All right. I don't see any more questions coming in. So I will give one last opportunity. Anybody on the Zoom call? All right, I think that's it. Lindia, thank you so much for the presentation. Very, very valuable information. We will use this as a tool to probably crop down this video and send it out to our team members here at the county. But a lot of great information. Again, thank you very much for taking the time to share this with us.
You're welcome. Thank you.
Okay, that brings us back to our agenda, and we have looks like a discussion on the 2021 Boundary and Annexation Survey discussion is what we have slated on the agenda. Who is going to lead off on that? Okay. Was Vicki Dalton going to be joining us for this one?
So, Mr. Chair, when I was talking to Mr. Maceo earlier, I was left with the impression that it was going to be a combination of Mr. Maceo and Ms. Dalton.
Okay.
We're going to be updating us on the status of this, but I don't see Mr. Maceo on the Zoom anymore. So
Now
maybe Mr.
looks like we have Kevin Norris. Looks like he needs promoted into the discussion.
Yeah.
1 second.
Yeah, Mr. Chair. Oh,
Yes, Jim.
yeah, that, my understanding was similar to Commissioner French's, that Kevin Norris was going to be involved. So if he can get in. Thanks.
Okay. Yep. There he is.
I don't see a Maceo on.
Yeah.
Hi,
So yeah,
everyone.
it does not appear Mr. Amacio is still on Zoom with us. So, but Kevin, if you can handle it, feel free
I
to
think I
take it.
can. I did talk with Mr. Amacio this morning, so we discussed this. Yeah, I think I can get through this just fine.
Perfect.
What this is something that we do each year. We manage the Boundary and Annexation Survey. We're reached out to by Mr. Mike Morgan, a demographer from Olympia, kind of the state representation, census representation. And they ask us if we want to participate in this annual survey. Basically, we provide information on all the annexations, jurisdictional annexations, even some county line adjustments that occur. We can track those as well. We always do participate in this. What's a little confusing this year in regard to the the questionnaire that was sent out to Commissioner French is that we typically get this in a big envelope. It comes in a really large envelope that usually ends up traveling around between the commissioners, building and planning, and it used to end up on Ian Von Essen's desk, and now it ends up on my desk. And typically I manage this. Basically, we answer the questions that are on this. We verify who we are, who our highest elected official is, and for the county, that changes every year. So since Commissioner French was our chair last year, he's the one that got this email this year. That's how this kind of goes. There's no signatures that are required, but basically it always comes back to me because there are a few questions that most of you probably can't answer, such as how do you intend on reporting this data? How will you be sending this? Paper, electronically, so on. So it usually comes to me. I work through all the details in getting this answered on paper. I always review it with Jerry Gimmel. Mr. Gimmel, you've always been most helpful on moving this along with me. I scan the documents and then send them back to Mr. Mike Morgan or Mormon, and we move forward. But this time we've got this in an electronic version, and I can simply fill this out, or I can assist you, Commissioner Kearns, in doing this. I don't think it really matters where this comes from as long as the information is accurate. You may want to send it back just so there's no question, Commissioner Kearns, that it, didn't come from the highest ranking county official, but I don't think that's really necessary. But honestly, what this entails down the road is we'll send this in within a few weeks. We will receive more information, more directions with timelines on when to get our boundary reviews and annexation information turned in. I can tell you that over the last all the years that I've been doing this, we always make this a priority. We feel that anything dealing with the census and demographics is of utmost importance in order for us to gain the federal monies that we need. We get right on this. We're never late in getting this back to them. Currently, I can't think, and I've asked my staff and posed the question to both building and planning and the assessor's office. Have we had any annexations over the past year? I'm not sure if we have or not. If we do or don't, we will get it reported appropriately and get this back to the Census Bureau. This questionnaire refers that we ask all questions that we may have regarding this to Mr. Mike Mormon at the Olympia office. Basically, he coordinates all census input received from all the cities and counties in the state, and just validates that, let's say we show that there's been a slight boundary adjustment between us and Stevens County. He will look for a similar adjustment on Stevens County's input. If Stevens County doesn't input, he will request that they do, just to validate that both agencies agree that this is the appropriate adjustment. Typically, there's no adjustments between counties, but there have been surveys that have moved the line slightly, and things like that do happen. Typically, this is more along the lines of cities annexing unincorporated properties. So basically, that's all this is just a questionnaire for us to fill out, allow the Census Bureau to get more current information in their books or, in their system for who's responsible and annexation survey.
Okay. Okay, I think, Kevin, you may have froze up on us.
Okay, you all froze up on me. Let me.
Oh, now I think you're back.
Okay, I was going to say, looks like all of you froze on me at some point in time. I'm sure I'm the one that froze up.
All right. Well, Kevin, if this is something you seem versed in this, like what this is. I'm comfortable with you proceeding with this survey, unless anybody else sees any pitfalls or has any concerns. I'm comfortable with you handling the survey. It seems like you know more about it than any of us do. So
yeah, what I'll do, Commissioner Kearns, is I will CC you on the results that I send back, and you too, Mr. Gimmel. Anyone else, if you want that, let me know and I'll send it to you as well. But this is standard procedure at this point. This will be a probably 2 to 4 hour project if there's no annexations for us to take care of in the next month or two. If there are annexations, we typically get the information, we review it, we meet as a group, we all review it. We'll invite some additional folks in just to validate that our information is accurate before we send it off.
okay. All right.
Chairman Kearns, this is Mr. Amacio. Can you hear me?
Yes, we can hear you.
Thank you, Chairman Kearns. Mr. Norris, the document that I looked at this weekend has to be signed by the highest elected official in the county, and that would be, of course, Chairman Kearns.
Okay.
Are you suggesting that the document be signed by Mr. Gimmel or you? And if so, we need a motion to that effect, Chairman Kearns. Otherwise, and if it's been signed by Mr. Gimmel in the past, then I would like a motion from the board authorizing him to sign the document on behalf of the chair of the board and to return it to appropriate entity.
Okay. Is there a motion to that effect?
So moved.
I will second the motion.
So second.
Okay. Motion and a second to authorize Jerry Gimmel to stand in and sign this document upon its submission. Any discussion? Seeing none, all in favor, say aye.
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 I
Motion
have to
passes.
say thank you, Mr. Amacio, for reading the fine print because I didn't see where we needed to seek out a signature on this particular document. So thank you for that. And Mr. Gimmel, I'll be approaching you soon. Thank you, guys. I appreciate seeing you all again, too. It's great to see you.
Yeah, thank you for joining us today, Kevin.
Bye-bye.
All right, that brings us to miscellaneous items. Does anybody have anything for miscellaneous matters this afternoon? Commissioner Cuny?
I think, just to circle back from this morning, we got the final draft of the letter that will be going in on 11:55.
Oh, yes. Yes, the draft letter, Jared they gave Commissioner French and I hard copies and emailed it to Commissioner Cuny. Anybody have any thoughts, any corrections, alterations to that draft?
I think I'm good with it.
Okay, yeah,
Yeah. I already gave my corrections to Jared and he incorporated them.
okay.
Josh,
Yes, Jim.
this is Jim. Commissioner French made a point this morning that I think is correct about if this results in any change from the earlier approval, there will need a motion now. I have not seen that document, so I might ask if those who have seen it, and particularly Commissioner French, if possible, if you believe this is such that it changes the prior approval that you made.
No, I think with a liberal interpretation of the motion we made, we should be okay.
Okay, thank you. Just wanted to double check since I hadn't seen it, and I agreed with your point this morning. Thank you.
Yep.
It is in your inbox, Jim Kaufman.
Okay, so Jared, is the intent for this to be signed by just us or everybody signing this one letter? All the different entities?
As of right now, the intent is to have all the entities sign it, including the 3 members of the city that were discussed.
Okay,
And,
all right. And I believe our motion from last week covers that. So I think we're good.
and just as a matter of logistics, Cheryl Yates at Shrek said that she was going to use the tool DocuSign to get that done.
Okay. All right. Okay, so we will look for that in our inboxes whenever that comes through. All right, any other miscellaneous items? Jerry?
If there's any questions from this morning about the films that we looked at, Cindy's sitting in or Miss Wendell is sitting in my office. If there's any questions.
Any questions, Commissioner French, Cuny?
Okay. Then the other item, Mr. Chair, is that we had a campus security meeting today over noon or over lunch, and 3 things had come up, and one of them was our challenge that we've been having periodically with some of the homeless folks settling in the courtyard. Proposal's been made that I'll be sharing with the board next week to increase the physical security with our contract with Phoenix. So say between the hours of 7 in the morning till maybe 9 at night. We'll have somebody here physically to keep an eye on the campus. But one of the things that I believe Mark McLean is working on, and Chris was working on it, is to change an ordinance that gives us some more flexibility about the camping ordinance, for lack of a better word. It seems to be one of the struggles people are having, is that there's really not anything you can lean on to have these folks move. And then on top of that, a third subject would be there's some things that we could look at enhancing security through architecture and maybe some other amenities that we can add, but that is historically has kind of got lost in our capital project list, and we're looking at ways of maybe separating the two so that the board can have more specifics to look at, just security capital projects versus general capital projects. So anyway, I told the committee that I was going to report back on our progress and where we're headed to the board. And if you have any questions. Okay.
All right. Thank you for the update, Jerry.
You're welcome.
All right. Does anybody else have anything for the good of the order? Otherwise, we will adjourn. Seeing nobody else stepping up, then it is 3:03 and we will adjourn for the day. Thank you all.
Just reading guidance.
Thank you.